What's going on, guys? Welcome back to WDYD CSP. What do you do as a central sterile processor? Guys, I got another good one for you. It's actually a continuation of a photo that I just posted up, so stay tuned, guys. All right, guys, welcome back. So a couple days ago, I posted up a video and I placed these two instruments side by side and said, what if this came down to decon? Same set, same manufacturer, same IFUs. Which one do you brush? I had an definite you brush both instruments because they're dirty. Then I said, okay, multiply that by 5. And then let's say we have 10 instruments, right? How many do you brush? And again, the answer is all of them. I asked this question, and that is the correct answer. But I asked this question because I asked this one. How do you clean this tray? Now I'm going to tell you, Hank from Beyond Clean had a hot topic conversation the other day, and I just couldn't be happier because that's the professional version. I'm going to do it the ghetto version, all right? I'm going to do it the raw and rough around the edges version. How do we clean this in decon? I'm going to tell you right now, we're not brushing every single instrument in there. I'm going to tell you, no, that's not happening. But should that be happening? Heck yeah, it should be. And I brought this conversation up because someone I precepted was getting pushback from a superior, a very high superior, stating that their decon process will not be slowed down by the brushing of each instrument, that they should only be brushing instruments that are visibly soiled. And that is so untrue and a huge risk to patient safety. But it is a common practice in our field. Tray comes down, however it comes down from the OR. So many times I have seen individuals not even rinse it. They place it right in the first sink that has detergent, which I have something against right off the bat, but we'll talk about that later. But they soak it in the first sink with detergent, maybe for a minute, 2 minutes, 30 seconds. Take it out of there, rinse it just the way it is, put it into the washer or ultrasonic just the way it is. Instruments not even open, not butterflied, not standing up, whatever, however you're going to put it in the basket, okay, whether this is best practice or not, and they go off in their ways, okay? Then I've been to other facilities where, yes, the instruments are taken out of the basket. They are sorted and butterflied the way they are right here in this basket, okay, placed in there, but still no brushing. They place it in the enzymatic, let it sit there while they sort the other instrument, the other basket. After they sort that, they take this basket out, put it in the next sink, rinse it, or put it in a sink that's full with water and think that that is a rinse. Place it in still water. Just sit it in there, then put the next basket in the enzymatic. Okay, take it out of that sink, and then in the final sink, they use the sprayer and then place it into the ultrasonic or the washer. Then there are other places that I have seen. They come out and they pull out instruments and they go, okay, that one's dirty. Let's rinse it, brush it off real quick, then sort it with the rest. Don't brush none of the other instruments. Again, soak it in enzymatic. Not allow the enzymatic to do its full contact or its full time allowed to break down the soil. Take it out of the basket, take it out of that sink, rinse it half-assed, and then throw it into the washer or ultrasonic, okay? In my opinion, the cleaning process, as I've stated before, should be that you sort the instruments, and as you're sorting, okay, your basket is the first thing that you clean. You rinse it, you scrub it with a brush, okay, to remove the soils, and in that first sink that you're rinsing, the second sink should be filled with enzymatic wash water. That's where it's going to sit in, okay? You're taking your instruments, and as you're sorting them, you're rinsing them, and you're brushing individual instruments, whether you grab them in pairs or you grab it one by one. Okay, you want to grab your instruments, you want to open them up as wide as they can, and you want to brush them under running water. Okay, all the exposed areas of the instrument. Okay, and you can grab 2 instruments in your hand just like I am right now. Okay, expose all those instruments. Do the same thing, guys. Okay, remove that visible and non-visible soil because that's what cleaning is. And then we're placing this inside the basket, and either you're going to do a open standing position or you're going to do an open flat position, depending on how you're going to store your instruments. Again, this is considered the best practice, but it's not always the best practice if you're stacking trays, right? Because if your instruments stick up too far past the tray and you're stacking, you're going to damage the tips of the instrument. So opening them up and laying them in an angle or laying them flat in the basket organized is acceptable as well. If you're using small trays, like this one here has instruments sticking up. If I put a basket on top of it, I'm going to damage it, but that's not the point. The point is that we're brushing every single instrument that we pick up, okay? Making sure that we're brushing them because cleaning is the removal of visible and non-visible soils, and biofilms aren't always visible to the naked eye. Bioburden is, but biofilms are not, okay? So brush your instruments, remove as much soil as you possibly can, put it in the basket to soak in the enzymatic or your neutral detergent. Allow the contact time for whatever it is, 5, 10, 15 minutes, whatever the IFU says. Allow that detergent to break down that soil further so that when you take it out and put it into the final sink, that spraying action that you're doing for the allotted time in the IFU, whether you're rinsing for a minute, 2 minutes, 3 minutes, you're actively rinsing. That spray has impingement. That's an impingement action. It's a mechanical type action that allows soil to be removed after the detergent did its job. You're spraying all those soils and residual detergent off of the instruments, preparing it for the next stage of its cleaning process, whether that's ultrasonic or that is washer disinfectors. All right. Another tip that I like to tell my technicians is that keep your suctions on the top, because if your suctions are on the bottom, you're not removing those soils. So I have this because this is just how I sort it, but your cannulated items should be on top. So that way when you're rinsing, you can grab a syringe or a spray gun if your last sink is fortunate enough to have a spray gun, and you're spraying down those cannulated items, those lumens, to get rid of the residual soil and residual detergent that's trapped in there. Okay, because if you're placing this in an ultrasonic like this, honestly, you're not really doing nothing to it, because the ultrasonic, if there's a pocket of air in there and it goes into the ultrasonic, it's not really doing anything. You should have this on in an ultrasonic irrigator. The same thing in your washers. In your washers, you want to position your lumen items in a way that it will drain water out of them rather than it sitting in there, because any residual detergent that's in there is also a threat and damage to patients. Guys, that is all I have for you guys today. I hope that this shed a little light. If you disagree, comment down below. If you agree, let's enforce it. All right. I know I tell my technicians and everyone that I train is this is the way we should be cleaning. Everybody modifies themselves once in a while, and I know that slows the process down. But as Hank stated in the hot seat, in that hot topic, and I agree 100%, we need to stop getting it done. Because if we are compromising patient safety, we are not holding up to the standards that we so-called follow. All right, guys, as always, like I said, stay true to yourselves, keep it 100. Peace.